Hi, this is Fred Havlicek here from Physical Therapy and Sports Medicine Center's New Haven office. And today we're going to be talking about an exercise known as an 11-to-1 exercise. And I have Allison here who's going to help me demonstrate that. So Allison, I'm going to have you lie down just on your back. And this is the simplest exercise that a person will ever do, but there's really a lot to be said about it. It is an exercise that is used to help relax muscles and ease low back pain. And the way that it's done is that the feet are together, the knees are together, and the knees are rocked slightly left to right, just like this. If you were to picture a clock, 12 being straight up, the knees would rock from 11 o'clock to 1 o'clock. And what this exercise does is it oscillates the little joints in the back called the facet joints. And those facet joints have inside of them these joint mechanoreceptors. These are what are called type 1 and type 2 white joint mechanoreceptors. And those receptors, when they're stimulated, send signals. And they send signals a couple places. They send them to the muscles of the back to tell those muscles to relax again and again. So if there is any muscle guarding or spasm present, it will help to ease those muscles. And it will also send signals to the nerves that carry pain messages, these A delta and C fibers. So by doing this, you can produce muscle relaxation and a pain reduction. So it can be very comforting and soothing when you're having back pain. Now, because the low back is an area that's hypermobile generally and is a natural hinge point, we don't want to take this exercise and go all the way to the side in each direction. Low back problems occur in those areas of the spine which are the most mobile. So by doing the 11-to-1, we capture the desired neurological effect and avoid the adverse mechanical effect of a big stretch. So if someone were to say, Allison, here, take this back and do what you can to hurt it. Let's see what you're going to do. Well, Allison would probably take that back and bend it, twist it, and do all of that. But if I said, Allison, here's your back, do what you can to hurt it, but you're not allowed to move it. Or you're allowed to move it just a little bit. Well, Allison's going to scratch her head. She's going to say, well, gee, I don't know how I'm really going to be able to hurt my back if I keep it kind of in small motions. So again, we want to avoid the big giant stretches because that area of the back is a natural hinge point already. And because back problems occur in those areas that are most mobile, we want to limit mobility in those areas and not try to gain more and more hypermobility in those segments. So, in order to get those desired effects that I talk about, the 11-to-1 has to go on for at least 2 minutes. So you would do this exercise for 2 minutes or more, as often as you like, to relax muscles and ease pain. So good luck.